All right, everybody, now we're back talking about your great smile, and Dr. Todd Shatkin is back with us from the Aesthetic Associates, and we were just saying, you're saying that so few people in your practice these days even wear dentures because of the success of the mini implants.
Yeah, absolutely,
That's
Linda.
Great.
The patients that have dentures in my office, most of them we convert to implant-supported dentures or permanent teeth because it's just night and day. I mean, these people have been living with and suffering from loose dentures for so long.
Right.
And for them to have the opportunity to get rid of that and have something that's stable and bite into corn on the cob and apples and stuff like that.
And there's different things for different people. So,
absolutely. So for patients that have a full upper denture, a lot of times we'll take the palate out of the denture so that they can taste the hot and cold foods and liquids, and then we'll put anywhere from 6 to 8 mini implants on their jaw. So this would be their gum tissue that you're looking at here, and then the implants go in the gum into the bone, and then the dentures snap in.
That's it.
Yeah. And they're very, very secure.
Now, do they sleep with those?
They can sleep with them. In fact, we recommend they sleep with them. So a lot of people like that because, you know, nobody wants to take out their teeth in front of their significant others. Right. So that's an upper denture. And we do the same thing with a lower denture. We put 4 mini implants on the lower denture. And then inside the denture, again, are these little housings that snap in. So the little O-ring housings in the denture. And then the denture then snaps on to those implants, and it's very secure. Yeah. So people no longer have to worry about putting glue or denture adhesives on their denture. They snap in and they're very secure. All they do is take them out to clean them a couple times a day after they eat, and then they put them right back in. So these are a couple of options. And the next thing we do for patients that want to completely eliminate the plastic in their mouth, we give them permanent porcelain teeth. And again, we put anywhere from 6 to 10 implants in, and we attach a permanent porcelain bridge. There's nothing at all on the roof of the mouth here. It's all porcelain. It's just like having your own teeth again. And that can either be snapped in or cemented into place, and the patients have permanent teeth. So these are the different options to replace dentures.
I would imagine when you first make that happen in someone's mouth, that's got to be an amazing moment for them.
You know, I've been in practice 26 years, and the most rewarding thing I do is change somebody from a denture situation to permanent teeth. And for them, I mean, it's so gratifying. They love it. They come and give me a hug. They can't believe that they suffered so many years with dentures.
Amazing.
And so we also use, of course, the mini implants that we've talked about for single teeth replacement. So here's an example of a single tooth that is replaced with a mini implant. And we just cement the tooth right onto that implant.
Isn't that something?
And if we're doing a molar restoration, we'll use 2 implants for a molar and 1 for each missing tooth. So here we have 3 missing teeth. We have a molar and 2 bicuspids, and we'll put 3 teeth on 4 implants. And so I wanted to kind of correct some of the misleading information that's been out there, and unfortunately coming sometimes from this show and this program with other guests. So I kind of want to show exactly what we do with mini implants so there's no question. So we try to replace each root with 1 implant. So here we have, you see, a natural tooth. After that tooth is extracted, we replace it with a single mini implant, and then we put a permanent crown on top of it that gets cemented over the abutment portion.
What kind of metal is that?
It's titanium. Titanium alloy, which is very biocompatible to the body. It's the same material used in hips and knees and everything else that are used. Very strong. You know, any implant has fatigue. Any metal has fatigue, and the thing about these mini implants, because they're one piece, there's no little screw to hold the top on. It actually makes them stronger. And some of the photos that were shown by the other dentist that had broken implants, they're not these implants. There are other style implants. There's a lot of manufacturers out there that make mini implants. Our implants are extremely strong. They're very durable, and I've been doing these now for you know, 16 years, since 1999, with really great success rates. Now for a molar, we don't put 4 implants or 5 implants in. We put 2 implants. We put 1 for each of those roots, again, just like this. You can see how God created our natural tooth to have 2 roots, so we replace the mini implants with 2 mini implants for a 2-rooted tooth, and then we cement our crown on top of that. Okay, so this is really the way it's done, and we mimic what God created for us. And I developed those procedures, so when somebody gets on and is critical of the procedures, obviously it affects me personally, and I want to set the story straight.
Did you want to show the pictures?
Yeah, I'd like to show a case. This is a patient who had obviously unattractive smile, had a bunch of missing teeth in the back, had an old bridge on the one side that didn't match the other teeth. So we'll go to the next picture. And next slide, please.
Okay, there we go.
And there's another picture with the cheeks retracted so you can see the big void in the mouth and the space. Next slide.
Okay.
Here's after the upper teeth were all replaced with porcelain bridge work and implants on the right side. Go to the next slide. And then the other side of that patient's mouth. And now we'll just show the final smile. And there's a patient after a full arch reconstruction procedure with mini implants and crowns all the way around. So, you know, beautiful. It changes somebody's life when they have that done.
Definitely.
You know, and the other thing I wanted to correct is the information about the success rates that I've had. So if we can zoom in here. This article was published in the Compendium magazine, which is a peer-reviewed journal, and this was published in 2012. What we have here is a 12-year study. We have a 12-year study, and we've had over 97% case success with mini implants over 12 years. Now, if you look at individual implants, you may have occasional failures, but what I showed you was when we do an upper denture, for example, we'll put 6 to 8 in. If you lose one, it may be a 15% failure rate, but if you have 7 remaining or 6 or 5 or 6 remaining, the denture still snaps in and it's still functional and the patient's still happy and comfortable. So a 92% success over 12 years of the individual implants doesn't tell the whole story. The story is that the patients have case success, they're happy, they're comfortable, they're eating, their dentures snap in, and they're very secure. For single teeth replacement, we have, for overdentures, we have 98%, for single teeth, over 95% success, and for permanent full mouth reconstruction, 99% success over 12 years. So this is the actual study out of the journal. If anyone wants a copy of it, I'm happy to give it to them. But to throw numbers around inappropriately isn't right. So I wanted to be very accurate with the representation. So as you know, we offer free consultations on any procedures at our office and free x-rays, so they can come in for a consultation.
And here's where you'll go. You'll go to the Aesthetic Associates Center, 839-1700, or log on to greatlook.com.